Hello guys, in today's video I'm going to show you how to remember SLE, and to understand it we have a house of a witch in which a girl's her name is Anna live, and she has so many weird things and she's performing some magical skill on this baby. So to understand it, actually there are 11 criteria for the SLE, and the presence of 4 or more than 4 criteria are the diagnostic of the SLE. So we will go in a stepwise manner to learn out this. So first we will cover the serology. So as you can see, her name is Anna, so this Anna will remind you of the anti-neutrophilic antibodies. Now come towards this, as she has a stick in her right hand and something is hanging from it. This double-stranded thread will remind you of the double-stranded DNA antibodies, and you can see something is hanging at the end, and there is right in Spider-Man. So this Spider-Man SM, this will remind you of the anti-SM antibodies. As you can see that she's performing an experiment, a magical spell on this baby, and she has controlled the baby, so the baby is shaking his head. So this shaking of the head will remind you of the epilepsy and seizure as well as psychosis. So this will remind you of all these things. Now come toward her right hands. As you can see, in the right hand she has 3 glass, 1 2 3. In this glass there is 2 little blood. So this 2 little blood will remind you of the pancytopenia. Actually there is thrombocytopenia, this is lymphocytopenia, leukocytopenia, and the second glass is broken. This broken glass will remind you of the hemolytic anemia, while in the third glass there is a heart, and this heart will remind you of the pericarditis. As you know, she is a witch, so she has also some tattoo on her hand. There is written MNOPD. So this M will remind you of the malar rashes. So remember this malar rashes are always present on the face. So she has also a small M on her face as well, and she has N nasopharyngeal ulcers, oropharyngeal ulcers, P photosensitivity, her skin will be photosensitive to the light, and D will remind you of discard rashes. Now as you can see, there are some bone in her room as well. So this bone will remind you of the arthritis, and this is the most common and the first manifestation of the disease. And she has also some kidney in her room as well, this will remind you of the proteinuria, and you can see there are some cast inside the kidney, so this will remind you of the RBC cast. Now you can see there is a auto car as well hanging from a threads. This auto car will remind you that SLE is an autoimmune disease. Now coming toward this, her name, as you can see, she's a female, so this will remind you that this disease is more common in the female and at the age of 20 to 30 years.